Hi, Borio Chiropractic community. Good to see our Borio Chiropractic family. Hey, a great surprise today. So I'm with Dr. Michelle Goldych, who I have the honor to work with every day here in the office. So
hello, everybody.
And Dr. Michelle Goldych is taking extensive training with the ICPA and working with moms that are pregnant and babies. And I thought today we'd spend a couple of minutes talking about the benefits of women getting care, and we see so many pregnant women in here, and I know that's a specialty of yours and certainly something you love to do, but why pregnant women love to be adjusted and why it's so good for them and their baby. I guess my first question, probably the most important, do you predict a baby boom happening with this quarantine that's been going on?
I would be curious what everybody else thinks about that too, but I think there's a pretty good likelihood that we have an increase of pregnant women walking through our doors in the next 6 or 7 months here.
I agree. I said to you earlier that liquor stores are open, so I'm thinking, it's an expensive bottle of Merlot, you know what I mean? It's like a glass of Merlot leads to 3, and then it's $300,000 later at SATs, and you're like, oh my God. So let's talk about the benefits. So I know you have extra training in dealing and taking care of women that are pregnant and taking care of babies. So I think the first question I would have for you is, one, what is really the benefit? Why would a woman that's pregnant think, wow, I should go to a chiropractor, this is going to be something to help my pregnancy or the experience or what have you for my body?
There's a lot of reasons. There's been studies done that show women who get chiropractic care while they're pregnant, obviously they're more comfortable while they're pregnant. There's a lot of really rapid changes to their body, not just physically, but hormonally and mentally too. So some of the benefits are the physical benefits of taking stress off of your body when it's all of a sudden having all this extra weight pulling on your spine that then puts pressure on the delicate structures around your spine, like your nervous system. So that's the obvious one. It takes the pressure off the joints, your pelvis, your spine, and then that takes off the constraint on the ligaments that kind of hold your uterus in place. So that allows the baby to get in a more optimal position for birth. Okay, and I know a lot of women who have had complications, oftentimes it's because the baby's not in a good position. So having room in your pelvis because your spine and your pelvis are aligned, just from that helps decrease the likelihood of needing emergency intervention, which is huge. And I know important to a lot of new moms.
So mechanically, I always use the analogy, I know you do too, like if I'm a machine or, we're kind of like, if you think of it as like a robot or a car, if that thing's bent or twisted, I'm obviously not going to have the room, that capacity in the uterus or womb where the baby's going to be able to move around because one side's going to be smaller than the other, right?
Absolutely. And then you can ask any mom who's given birth, the extra couple millimeters from pelvis being aligned would make a huge difference when actually giving birth too.
Yeah, you talked about comfort. That was the first thing you said. So talk to me a little bit about that. So if I'm a mom, sometimes I guess you think pregnancy is supposed to be uncomfortable, or I don't feel good because I am pregnant, and that's kind of a misnomer, right?
Right. And are you always going to feel great? Probably not.
Right.
However, getting adjusted is going to help alleviate a huge amount of stress from your spine. There's a lot of rapid changes. As your baby grows, it pulls and pulls on your spine. Your chest grows, that pulls on different parts of your spine. So that extra tension really makes for a lot of unnecessary discomfort if you can get adjusted and take the pressure off with a really simple, gentle adjustment. Right,
and I think that leads to the other question. Like, I can imagine, especially a first-time mom, and that's understandable. It's the first time, you're maybe a little bit more anxious, you're a little bit more nervous, the stress level, is this normal, is this not normal? Whereas if you have 2 or 3 kids, you're like, even though it may be uncomfortable, you're so used to it. And it comes down to that safety factor, because I know I've been asked that, and I know you have too. Like, some women think, hey, geez, it's safe for me to be adjusted. Is it safe for my baby? So.
Right. So first of all, any person who comes in our doors, obviously, you and I take safety very seriously. We're very thorough when we take your health history. You might have an underlying condition or something like that, in addition to being pregnant, that we have to address.
Sure, totally.
Definitely look at your health history, do an exam, make sure everything is safe to adjust you. And there's always, people don't realize, more than one way to adjust someone. So I might not adjust you the same way I adjust my grandmother or my newborn nephew or something like that. There's different techniques, or sometimes two pregnant women, I might have to adjust them different because of what's going on in their body. So we always take the time to do that. And then part of caring for pregnant women is learning how to adapt to the changes in their bodies. You know, we have tables that move and make room for your belly to hang down, or we change the position that we adjust you in or something like that to make sure that you're comfortable and safe. Because, you know, that's the most important thing. We're here to help keep people healthy and would never take an unnecessary risk with somebody.
Right. I know we have a poster or two in the office that lists a lot of the benefits to mom and the baby to be under chiropractic care. I thought maybe you could just throw a couple of those out.
Yeah, so the big thing why chiropractic works for anybody is because it helps remove interference to your nervous system. So when you have something out of alignment in your spine, it's going to put pressure on your nerves.
Yeah.
Okay, and you know, we don't think about this, but what do your nerves really do? You know, how is your body really functioning? Like, what controls your body?
Right, the nervous system, right?
The nervous system, right? So your brain needs to send a signal through your
spine,
through your nerves, right? So if you have pressure there, it's going to disorient, slow down, and mess up those signals. Just like if we had a bad internet connection right now, you might not be getting this conversation fully. So when we take the pressure off, it lets the messages get through. So for a pregnant woman, the messages from your lower back, you know, where do those nerves go?
Yeah, they're going to go to the uterus right out of the gate. I mean, not
pelvic
to mention
muscles,
pelvic muscles,
right? Things that control your hormones, stress levels, cortisol, all that stuff is affected when your nervous system has extra stress from being out of alignment on it. So for anybody, taking that pressure off is going to have a huge improvement in your health because things are working the way they're supposed to now.
Yeah. And the baby's health, so they were talking about.
Right, so your baby is, you know, think about trying to, you know, they always talk about decreasing stress in women and being really healthy. You know, we take better care of ourselves when we're pregnant than any other time in our lives because everything you do to your body has an effect on that health, including removing stress from your nervous system. So, you know, is your baby being created and developing in the womb in a stressful situation where you're in pain and discomfort and stressed out, or are you being as healthy as you can be and giving that baby the best possible environment to grow in?
Yeah, so science shows if you're a mom under chiropractic care versus randomly chosen versus a mom who's not received chiropractic care, delivery time is decreased, strain and stress to the mom is decreased, strain and stress and trauma to the baby is decreased, the need for medications during the pregnancy is decreased, episiotomies and abnormal positioning of the baby dramatically decreased. So again, it doesn't eliminate every issue, but like you were saying, if I'm healthier as a body, my baby's going to be healthier, my pregnancy is going to be healthier, my delivery is going to be so much healthier.
So it's just another critical way of taking care of yourself while you're pregnant.
Which is awesome. So guys, listen, if you're pregnant, if you know somebody that's pregnant, we're right here in Cicero. We're central New York. And Dr. Michelle is part of our practice who loves to take care of women that are pregnant and babies. So if you're looking to include, and I hope you would, chiropractic care in the pregnancy or certainly your overall health, life services, we would certainly love for you to call the office. Specifically ask for Dr. Michelle Goldych. She'll be happy to set you up. And then we're doing a program, just especially because of the COVID thing, we're doing a checkup for $27.
Trying to help everybody out.
So $27 comes in, get your initial exam and evaluation. So it makes it really easy and affordable and simple for you. And then you can come in, Dr. Michelle will be happy to take a look at you, see what's going on, and then find those areas that need some special attention. I'm also excited because we're going to do a video next week, and we're going to be talking about
babies. You know, what happens to you postpartum for you and your baby, and how can we help you and your baby be healthier? And, you know, what's an adjustment for a baby like? Why would you want to get your baby adjusted? What's the advantage to that for you and your baby? So it's going to be really interesting. It's going to be a good one.
It's such a great question because, you know, you and I knowing what we know, we're like, oh my God, how can you not get your child adjusted? But the average person's not really aware of it. It seems unusual because it's not something they're familiar with. They didn't grow up with it. So.
And it's so important. We decided to do a separate video. We were originally going to include it in today, and they said there's no way. Pregnancy getting adjusted is so important, and babies getting adjusted is so important. So many people have questions. We need to do two separate ones.
For sure. No, totally agree. So check us out. You can hit the link above or below. You can call us directly in the office. If you guys go to our website, boriochiropractic.com, it'll ask you, hey, I'd like to set up an appointment. And then when you call, the staff will ask, hey, how'd you hear about us? Just let us know you saw the video, and you can set up an appointment to be checked and evaluated by Dr. Michelle. Nobody, you're not going to be in any better hands than Dr. Michelle Goldych as a pregnant mom and as a baby for sure. So thanks so much for tuning us in. Thank you, Dr. Michelle, for giving us some extra time. And we'll talk to you next week about the importance of getting your baby or child checked and adjusted by a chiropractor. Thanks so much.